Today's GutFlix topic is understanding Helicobacter pylori. Helicobacter pylori or H. pylori is a type of bacteria that primarily inhabits the stomach lining. It's unique because of its ability to survive the highly acidic environment of the stomach, thanks to its spiral shape and the enzyme it produces called urease. This enzyme neutralizes the stomach acid around the bacteria, allowing it to thrive in an environment that would typically kill most other microorganisms. Discovered in 1982 by Australian scientists Dr. Barry Marshall and Dr. Robin Warren, H. pylori was initially met with skepticism. For years, it was believed that no bacteria could survive in the stomach's harsh acidic environment. However, Marshall and Warren's groundbreaking research, which even included Marshall ingesting the bacteria himself, revolutionized our understanding of stomach ulcers and gastritis. Once H. pylori establishes itself in the stomach, it begins to wreak havoc on the lining of the stomach and the upper part of the small intestine. The bacteria's presence triggers an immune response, leading to inflammation known as gastritis. Over time, this can erode the protective mucus lining, making the stomach and duodenum more susceptible to damage from stomach acid, which can lead to the formation of ulcers. So, how does one contract H. pylori? The exact mode of transmission is still not entirely understood, but it's believed to spread through contaminated food and water, as well as direct contact with saliva, vomit, or fecal matter. This means that in areas with poor sanitation and hygiene, H. pylori infection rates are significantly higher. H. pylori infection is a global issue, with infection rates varying significantly by region. In developing countries, it's estimated that up to 80% of the population may be infected, compared to about 20 to 50% in more developed regions. Interestingly, many people infected with H. pylori never develop symptoms or related health issues in the early phase of infection, which makes it even more challenging to detect and treat. While some people with H. pylori infection may remain asymptomatic, others may experience a variety of symptoms. Common symptoms include burning pain in the abdomen, nausea and vomiting, loss of appetite, frequent burping or bloating, unexplained weight loss. If left untreated, H. pylori infection can lead to serious complications. The most common of these are peptic ulcers, which can cause significant pain and discomfort. In rare cases, chronic H. pylori infection can even lead to stomach cancer. Diagnosing H. pylori infection typically involves several tests. The most common is the urea breath test, where the patient drinks a special solution and breathes into a bag. If H. pylori is present, the bacteria's urease activity will produce a specific gas that's detected in the breath. Other diagnostic methods include blood tests, stool tests, and endoscopy with a biopsy of the stomach lining. Treatment for H. pylori usually involves a combination of 3 or 4 medications, typically for a period of 14 days to complete the course. This treatment regimen, often referred to as triple therapy or quadruple therapy, is typically successful in clearing the infection. Preventing H. pylori infection largely involves maintaining good hygiene practices. This includes washing hands regularly, especially before eating or after using the bathroom, ensuring food is properly cooked, and drinking water from safe, clean sources. In regions where H. pylori is more prevalent, these preventive measures are particularly important. Don't forget to like, subscribe, and hit the notification bell to stay updated with our latest health videos. Stay healthy, and see you next time.